Measuring success in ulcerative colitis, understanding remission and the tests that track it for those living with ulcerative colitis. You see, the ultimate goal of treatment is remission. However, feeling better is only one part of the equation. Medical professionals distinguish between two distinct types of remission, and understanding the difference is vital for long-term health management. The two pillars of remission to achieve true stability, patients aim for two specific milestones. Clinical remission. This is the absence of physical symptoms. You feel better and issues like bleeding, abdominal pain, or urgency have subsided. Endoscopic remission. This is the actual healing of the intestinal lining, the mucosa. Why this matters? It is possible to feel fine, clinical remission, while the bowel is still inflamed, lack of endoscopic remission. Experts, including Dr. Adam S. Chaffetz of Harvard Medical School, emphasize that achieving endoscopic healing is the gold standard. Patients who achieve mucosal healing have a significantly better long-term prognosis and a lower risk of complications compared to those who only manage their symptoms. How doctors track progress, because symptoms don't always tell the whole story. Doctors use a variety of diagnostic tools to monitor inflammation and check for healing. Visual inspections, endoscopy, these procedures allow doctors to see the physical state of the colon. Sigmoidoscopy, a less invasive look at the lower third of the colon. Colonoscopy, a comprehensive examination of the entire colon. This is more invasive, requires sedation, and often necessitates a strict liquid diet beforehand. It is the most effective way to check for inflammation, bleeding, and precancerous growths. Biopsy. During an endoscopy, doctors may take small tissue samples. These are analyzed to confirm inflammation levels or to rule out concurrent infections and precancerous cells. Laboratory tests. Blood and stool biomarkers provide a snapshot of inflammation levels without the need for invasive procedures. Fecal calprotectin test. A stool test that measures a specific protein released by white blood cells in the gut. High levels are a strong indicator of active inflammation. It is often used to monitor how well medication is working over 3-6-month intervals. C-reactive protein, CRP, test. A blood test that detects systemic inflammation. While not specific to UC, a drop in CRP levels often indicates that a treatment is successfully reducing inflammation. Complete blood count, CBC. This monitors for anemia, a frequent complication of UC caused by intestinal bleeding and poor iron absorption. It also helps detect infections. Advanced imaging and ultrasound when visual inspections aren't feasible or more detail is needed. Doctors turn to technology. CT and MRE scans. These provide 3D images of the colon. Magnetic resonance elastography, MRE, uses MRI technology to create detailed views of the gut, helping to assess ulcers and inflammation. Intestinal ultrasound, a non-invasive method gaining popularity, this uses sound waves to detect thickening of the bowel wall, a key sign of inflammation. Summary table. At a glance test type method, primary goal endoscopy visual camera, confirm mucosal healing and check for growths. Biopsy tissue sample rule out infection and assess cellular health. Fecal calprotectin stool sample detect localized gut inflammation. CRP test blood test monitor systemic inflammation levels. CBC blood test check for anemia and infection. Imaging CT MRE 3D scans visualize abnormalities and inflammation. The bottom line, remission is more than just the absence of pain. It is the physical healing of the digestive tract. By combining symptom tracking with objective tests like fecal calprotectin and colonoscopies, doctors can ensure your treatment plan is effectively preventing long-term damage.